Hey seniors, definitely wish I was here teaching you in person again, but it is a joy to at least be able to do what we're doing, that's for sure. But I miss you guys, and I can't wait to see you again. Just want to cover chapter number 14, talking about the respiratory system. Want to jump in here. So if you would, go ahead and grab your books and follow along with me. I try not to do these long videos. I try to keep them 15 minutes or less. I think my last one went just a little bit over, but that's okay. All right, but page 230 is where I'm going to be, and we're just going to go through this very quickly. I know you guys are thinking, man, it took us forever to get through a chapter in school. Why can't you do it then? You know what? Don't worry about it. But turn to page 230. We're going to jump right into this, okay? Talking about the respiratory system as far as the breathing goes. And I like this. The respiratory really consists of the lungs and the airway. Airway and lungs. It's worded both of those ways here in the chapter, but it's basically a series of tubes through which air flows to and from the air sacs in the lungs. And that's kind of what we're going to be talking about, the lungs, breathing, all that goes into it, but a very brief sample size, if you will, recap of the chapter, okay? So a couple things. A breath of air enters the body through the nostrils. I think we understand obviously what those are, the two holes at the bottom of our nose, okay? And go through the nostrils, which of course is the openings into the nose. They flow through the nasal cavities, right? And we understand we've got lots of different nasal cavities there, but we've got those. And then goes to the pharynx. Your pharynx is basically your throat, and that's kind of the term given to when we talk about the throat in its general sense, okay? And then it goes from your pharynx, your throat, to your larynx, which is your voice box. Good, I know you guys got it. But your larynx or your voice box, and we'll talk about how that works in just a minute. From there, it goes into the trachea, or basically your windpipe is what that is, and that's on your quiz, so be ready for that. Air then enters the right or left primary bronchus, or bronchi, and after it enters each lung, and then it just goes on from there and keeps dividing and dividing and dividing. So we're going to talk about really quickly, they're the nostrils. Page 231 is where I'm at, moving quickly. All right, page 231, the nostrils, or another word for that is the nares. It looks like it's, the way it's spelled is like nares, N-A-R-E-S, but it's pronounced nares, and that's just a fancy name for your nostrils, and that's really what that is. Pretty interesting. You talk about the nose hair that you have. I know that's so gross, but I don't know what it is. I kind of know what it is, but with old people, they have they just don't care anymore. The hair in places that you're like, what is going on? It's just growing in the ears and in the nose, and it's just like, and you're like, come on, stop. You got to go to the barber and get that out. But they have that going on. That's actually there designed to help you. And everyone has it, okay? Everyone has it. But it's there designed to help you so that way large particles don't get all up in there and cause infection or other sorts of problems there, okay? So that is there to help you, but it's still kind of gross to talk about. And the nostrils open into two nasal cavities, which are separated by a partition. That's called the nasal septum. And so if you want to get a good look at that, that is basically the divider in between your two nostrils. That's called the nasal septum. And of course, it goes up a good ways. And if you want to get a great look at it, then you can go in the mirror, tilt your head back, and remember, and when you were a kid, and maybe some of you still do it, I don't know, when you want to make yourself look like a pig, you kind of push your nose up like that. That's a great way to get a good view of it. So you can do that. Moving on. We're gonna keep on going down. The pharynx divided into three regions. I'm literally just gonna name them for you. You have the nasopharynx, the oropharynx, and the laryngopharynx. And so those three different parts, but we're not gonna focus a lot on that. I just wanted you to be familiar with those terms. We are gonna talk about the glottis. That's at the top of page 231. The opening into the larynx is called the glottis. Remember, your larynx is the voice box. Good job. And but the opening into the larynx is the glottis. All right, check this out. This is pretty neat. The wall of the larynx is supported by cartilage. Remember, cartilage is kind of like what your ear is made up of. That protrudes from the midline of the neck, or basically cartilage from the middle of the neck, protruding, kind of sticking out. All right, and sometimes it's referred to as the Adam's apple. You can kind of see it right there. And they say it is more prominent in men. It certainly is. And so sometimes the misnomer has been, well, only men have an Adam's apple. Not necessarily true. It's just very prominent in men. So, if you see one in a lady and the Adam's apple is there, oh, you're a man. And no, not how that works. But that certainly is more prominent in men. But that's kind of what that is. Just some cartilage sticking out there. All right. And laryngitis, right? That's an infection of the larynx, and laryngitis. You think of itis, it's like an inflammation. There's something going on there that should not be. All right. The vocal cords. This is neat. The vocal cords are muscular folds of tissue that project into the larynx from its lateral walls. This is neat. The vocal cords vibrate as air from the lungs rushes past them during expiration. Expiration is breathing out. Doesn't mean like you expire, so you're dead, okay? There's inspiration and expiration. We'll talk about that in just a little bit, all right? And then during swallowing, there's a flap of tissue called epiglottis, your epiglottis. What it is, it's literally a flap of tissue that opens and closes. It closes so that way food does not go down into the wrong place. And oftentimes that does happen, right? It closes off closes off the larynx so food and water don't enter the lower airway. But sometimes it does malfunction. And I'm sure all been there before where we're swallowing something. Maybe we're trying to talk and the epiglottis is open and we swallow and, it's like, oh yeah, that was, and we just keep coughing and coughing and coughing. And isn't it like the most embarrassing thing when you cough and you're trying to stop coughing, and especially if it's in a quiet setting and you just can't help it, and then you try like holding in your cough and you're like, and it just keeps coming out. You're like, please stop. But your body, it's that natural reflex, like, nope, epiglottis messed up. Thanks a lot, epiglottis. But you keep that happening. That happens, no doubt, right? Moving on down here, we're going to look at the bronchial tree, the network of branching air passageways within the lungs. That's the bronchial tree. And I do encourage you to take a look at page 230. You can kind of see a good example of what it looks like somewhat inside of the lungs. It looks like a tree branch kind of sticking out with other branches. Then it gets much smaller and spread out, almost like, little tiny limbs, if you will, that you could break off, have a little campfire, roast some marshmallows. Okay, I'm getting off track. But you understand what I'm saying. It really does look like that, and that is really a complex process, the air going in your lungs and going out to all the different places, and it's designed very, very specifically, and it really is a neat thing. But the bronchial tree, again, that is just a network of branching air passageways within the lungs. You do have something in your body called the hilus there. Each primary bronchus enters its lung at a depression called the hilus. And a depression doesn't mean like you're sad and you can't get over it because we're all quarantined. No, but a depression literally means like an indent. If something is depressed, you think about like pressing something down and it's got a depression like that. Okay, that's what we're talking about. All right, we'll turn the page here quickly to page 232. I want to look at the diaphragm. And very, very important thing here, we're going to talk about the diaphragm. It is a strong dome-shaped muscle that forms the floor of the thoracic cavity. Remember, your thoracic cavity is about that area right there. And it's basically your chest area, the inside area, and as you breathe and all of that. So this is the way your diaphragm works, right? It's a strong muscle. In fact, when you speak, when you sing even, you're supposed to use your diaphragm. And if not, you're putting more strain on your throat, your larynx, your vocal cords, and you tend to wear those out rather quickly. You lose your voice. When you use your diaphragm, you don't lose your voice, or at least don't lose it as fast because you're breathing properly, and that goes a long ways. Honestly, lots of speakers and singers, that is a big thing. Mechanics, how they learn how to work with that muscle. It's very important. But as you breathe, right? We talked about inspiration and expiration. Inspiration, breathing in. Think about inspiration of the Bible. God breathed, right? And so the inspiration, that's breathing in, and then expiration, breathing out. That's what that is. And aren't you guys glad we're not here? Because then we'd all be doing it. And then the room would just smell like everyone's breath, and that's kind of gross. All right? But inspiration, breathing in, breathing out, right? Your diaphragm, it's amazing how that works, all right? It's going to be a little different, so I'm going to explain this to you. The diaphragm, when relaxed, has a dome shape like that, and a dome shape. So when it's relaxed, that's what it does. It relaxes when you're breathing out. Obviously, when you have it dome shaped, that's less area in the thoracic cavity. If I have this much area, but my diaphragm is doing that, now I only have that much area, right? You understand what I'm saying? And so then, during inspiration, the diaphragm contracts, but when it does, instead of doing a dome shape, it actually kind of flattens and almost depresses a little bit to go down to give you more room. As I breathe in, and your diaphragm is contracting, but it's kind of lowering to have more room in your thoracic cavity so you can have more air, so you can breathe in more oxygen, and you have all of that inside of you. Again, I encourage you to look at page 233 to kind of understand what I am talking about. Very interesting stuff, okay? Turn to page 234/235, talks about diffusion, and you can have a collapsed lung. It mentions that on page 234. And when these air sacs inside your lungs collapse, and kind of like a deflated balloon, the book calls it, and blocks the movement of air, that's obviously not good, okay? But on page 235, you'll see this little chart at the top talking about inhaled air and exhaled air. Obviously, inhaling, you're breathing in lots of oxygen, very, 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 very little carbon dioxide. But when you breathe out, you're actually breathing out a lot more carbon dioxide than when you breathe in. Now, most people believe, I say most people, a lot of people believe that when you breathe out, you're breathing out only carbon dioxide. That's not true, okay? You are still breathing out some oxygen that either wasn't used or whatever the case may be, but you are breathing out a lot more carbon dioxide than you breathe in, and that's just the nature of the body. In fact, I will mention that here. As blood circulates through the tissues, oxygen moves from the blood into the cells, where it's more concentrated to where it's less concentrated, and that's how that works. All right, check this out. Carbon dioxide is produced by the cells of the body during cellular respiration. Remember, that's the process by which cells capture energy from fuel molecules. So as you are doing something, really like living anything, okay, your cellular respiration is going on, that produces carbon dioxide, so therefore it goes and you breathe it out. And you need the oxygen in, carbon dioxide out, okay? And oxyhemoglobin, I want to touch on that, page 235 at the bottom. When oxygen diffuses into the blood, that's good, it enters the red blood cells and forms a weak chemical bond with hemoglobin, forming oxyhemoglobin. Oxygen, hemoglobin, oxyhemoglobin. Mind blown, right? And moving on, we're almost done here. Page 236, the last really thing that I want to concentrate on is CPR. Now, you're going to need to know this for your quiz tomorrow, all right? CPR stands for cardiopulmonary resuscitation. 2 words, cardiopulmonary resuscitation. You are resuscitating and giving life back, if you will, okay? Cardiopulmonary having to do with the heart, jolting that heart back. And I am actually pretty neat. My mom teaches CPR, which is so neat. We were going to try to get her here towards the end of the school year, try to certify everyone or at least teach the material. It was going to be awesome. I'll stop dwelling on that. But it was going to be neat, and but she's actually certified me before, and I've taken the classes, watched some videos. She's taught me. It's been great. It did take me 2 times because the first time I didn't pay attention because it's my mom. You guys know how it is. But just like I'm sure you're paying so much attention right now. But the CPR, and it is really neat how that works. But CPR must be started immediately, and because after about 4 minutes, not of doing CPR, but if you don't, depending on if there's some sort of stoppage, cardiac arrest, respiratory, something along those lines, brain damage can occur, and that can be lasting. That can be forever, and so you've got to have that. In fact, one time our neighbor growing up just had a heart attack out there in the yard. His wife came out and he just gave him CPR, gave him CPR. I mean, would not stop, over and over and over and over again. Eventually, ambulance and all that came, and she thought for sure he's gone, and he's dead. And miraculously, he lived and didn't have brain damage. And it was just an incredible story, really neat. My parents got a chance to witness to him. It was really neat. But thankfully, she started CPR. I mean, as very, very quickly, and that was really what helped him and saved him. But breathing, there's so much that goes into it, and your breathing is regulated by your brain, which is incredible. Again, you don't want the brain damage to happen. There's just all sorts of stuff that goes into it. But this was just a quick recap, and I want to spend so much more time on all this stuff. but we don't have more time, okay? But I love you guys. I miss you. Hopefully you get the material, work on it, understand it. But hey, I cannot wait to see you again. Bye.